Excited that Dr. Julie is with us today because this is such an important topic, one that's close and near and dear to my heart. So let's just get into it. Julie, for the people that don't know you or know your background, can you give us just a quick little synopsis of your background, who you are, what you do?
Yeah, thank you. Appreciate being here. I've been a nurse for over 4 decades. I started out, my mom said to me when I was 16 years old, "Why don't you be a nurse?" And I was like, yeah, that sounds like a really good idea. And I just have to say, it's been the best decision I've ever made. So the first half of my career, I spent at the bedside taking care of patients. I worked ICU, critical care in the trauma department, and then I was on the helicopter for 10 years. And then it was time for a change. And so my friend said, hey, why don't you come over and teach with me at the university? And I was like, I like that idea. So now I've been in nursing education for about 15 years.
That's on the helicopter. You must have a lot of stories just for that, but that's probably pretty interesting. Yep.
Yeah, and at my university right now, my students always want to hear those stories and hear what that was like, because some of them, that's already their aspiration.
Hey, that's great. One of the reasons you're here with us today is because you wrote a book, a fantastic book about surviving your hospital stay. So let's talk about that. Let's get into it. You have a mission, right? Let's tell us about your mission and tell us what motivated you to write this book.
What motivated me to write the book, my parents were in a plane accident after I was a nurse for about 10 years. And I was across the country with 5 children, a brand new baby, and a full-time job. And I couldn't be there with my parents. And so it really sparked, please take care of my parents like I would, because I can't be there. And so I've always had compassion. That's just part of my nature, but that took it to a new level. And then when I started in nursing education, one of my professors, I had to choose my project for my master's thesis. And she said, why don't you talk about failure to rescue? And like I said, I had already been a nurse for quite a while. And I'm like, I'm not sure what that is. And when I researched it, it resonated with me because of my parents' situation. They both survived, by the way. But it was really shocking to find the information about failure to rescue, which is patient deterioration that's unrecognized. And then I realized in that research that, and in my own experience, there were so many nurses that did not practice the concepts that we teach in nursing school. And so that kind of became my mission, is to educate more nurses, to spread what we need to be doing in the profession. And I just found that there were so many people that have no healthcare background at all, and yet healthcare is going to touch every single one of us, whether it's personally or with our family or friends. And the other piece of that was learning how many preventable medical errors happen on an annual basis. So back in 1999, the Institute of Medicine published a white paper called "To Err is Human," and they really put the spotlight on preventable patient errors. They estimated back then that it was about 50 to 100,000. Later, when they did retrospective chart reviews, they found, oh no, it's probably at least double or triple that amount. And so we have not really moved the needle in healthcare for patient safety. So the purpose of this book is to save 10,000 lives if I just save one by helping educate the layperson, as well as nursing education for those basics, to really understand more about what healthcare is and how we can be partners.
That's amazing, to save 10,000 lives. And you've got such a big background because, some people just have the bedside experience and some people just have the educational experience, but you've seen it from all spectrums. And, there's a lot of great stories in this book, which are touching, but also kind of shocking. And, from all this, what are some of all your experience, what are some of your biggest ahas, maybe 1 or 2 or 3 of your biggest ahas, if you were going to talk to somebody and say, oh, I can't believe this, right? Or I couldn't believe this when I realized this.
One of the things that really hit home to me is there was a study done back in 2006 of newly graduated nurses. So it was a big N. If you're in research, you understand that, what that means. But It was a big study of over 5,000 newly graduated nurses. So they passed their NCLEX and got their nursing license all the way up to within a year of practice. And what they did was it was a 5-hour exam, so it was hands-on practical as well as written. And they found back then that there was only 35% of these newly graduated nurses in the first year of practice that were ready for practice or safe. A decade later, they repeated it, again, over 5,000 newly graduated nurses across 26 states and 141 different nursing schools. So it isn't a particular school or location in the country. And they found that it had fallen from 35% practice ready down to 23%. Then after the pandemic, and we do know that that pandemic really impacted nursing education, some of those nurses during that time only did video learning and did not have hands-on application. So Kavanaugh, again, I've got all these research articles and evidence-based, so this isn't just my opinion about things, but it was shocking to find that from 35% in 2006 to 23% in 2016, a decade later, and then repeated in 2021, it had fallen to 9%. So we have less than 1 in 10 newly graduated or new nurses that are safe and ready for practice. The other part that's really influential is nursing schools are a bachelor's degree program for a lot of them. A bachelor's degree should be 4 years. Nursing, a bachelor's in nursing is the second hardest bachelor's degree in the country. First is engineering, and then is the bachelor's in nursing. And we take that 4-year program and condense it into 3 years because the students just want to get out and practice, and we need nurses desperately. So now we're doing a 3-year program, and it's so much information to keep patients safe and keep them alive and help make them better and not worse. So those are kind of the biggest aha moments that I'm like, my goodness, we need to do something different than what we've done because patients still aren't safe. Unfortunately, the preventable deaths are still way too frequently happening. So I compare that number of between 250, 300,000 patients dying every single year, equivalent to 2 Boeing 747 jumbo jets full of people falling out of the air and crashing every single day. That's the shocking part of what those statistics, translate to. And every one of those is somebody's mother, father, brother, sister, right?